So today I'm going to explain regarding the instability of the shoulder joint. Our last two videos were about the stability of the shoulder joint. In that we saw about the static as well as the dynamic stability. So when you think about the instability of the shoulder joint, when you think about the shoulder instability, what do you mean by shoulder instability? Shoulder instability means the head of the humerus is moving out of the glenoid fossa. This is called as shoulder instability. And what are the degrees of shoulder instability? Shoulder instability can be broadly divided into two categories according to the degree. One is shoulder dislocation and second one is the shoulder subluxation. Okay, what is dislocation? In case of dislocation, the head of the humerus is totally out of the glenoid fossa, whereas in subluxation it is partially out. So instability can be classified according to the degree of instability, that is dislocations and subluxations. Okay, and according to the direction of instability, we can classify shoulder dislocations as anterior dislocation, the posterior dislocation and inferior dislocation. Of these three, anterior dislocation is more common. Okay, according to the direction of dislocation or the direction in which the head of the humerus moves out of the glenoid cavity, instability or dislocations can be classified as the anterior instability, where the head of the humerus moves anterior, and the posterior instability when the head of the humerus moves posteriorly, and inferior dislocation where the head of the humerus moves inferiorly. Okay, and before going into the dislocation, first let us see a few important criterias we need to know before going for the assessment. And what are those criteria? So those criteria are the signs and symptoms. First, let us see what you mean by the signs and symptoms. What is a sign? Sign is always objective and symptoms are always subjective. What is the difference between a subjective as well as an objective? Objective means, so as I told, sign is objective. What is an objective? Objective means the things what an examiner or a therapist can observe on the patient using his senses. What all things what the examiner can observe using his senses. Whatever the examiner can see, whatever the examiner can hear, whatever the examiner can smell, whatever the examiner can feel by touching, okay, and whatever the examiner can measure, whatever the examiner can photograph, all these comes under the objective assessment. That are the signs. So signs are nothing but are the objective which can be seen by an examiner, which can be seen by an examiner, which can be heard by an examiner, which can be smelled by an examiner, which can be felt by an examiner, which can be measured, which can be photographed. And these objective or the signs are based on real facts. These can be verified, and this is based on evidence based information. Based on evidence based information. And what are the signs? High blood pressure. High blood pressure is a sign because using the sphygmomanometer you can measure the blood pressure. So it can be measured, it can be documented, it can be verified. And another example for a sign is hyperglycemia, that is increased blood sugar. It can be measured, it can be documented. It is based on evidence-based information. The third one is fever, hyperparaxia. Again, using the thermometer, we can measure the degree of fever. The fourth one is swelling. You can see the swelling on the patient. You can see the swelling on the patient. And again, swelling can be measured. What are the methods by which you can measure swelling? Swelling can be measured using volumetric measurement, that is using water volumeter. Then it can be measured using the girth measurement using tape. And thirdly, the pitting edema. How you can measure the pitting edema? By measuring the depth as well as the duration of the indentation. When you are making an indentation on the pitting edema, you can measure it by the depth as well as the duration of the indentation. Okay. And what are the other signs? Cyanosis, bluish coloration of the skin, the clubbing of the fingers. All these are signs. So signs are objective. And what are symptoms? Symptoms are subjective. That means symptoms are which are saying by the patient. We can collect the symptoms only through the information what is given by the patient. And we cannot measure, and we cannot have a evidence-based information, and we cannot be documented. And what are the symptoms? So this is purely, symptoms are subjective, which is purely based on the information given by the patient. Then let us see what are the symptoms. Pain is a symptom. Why pain is considered a symptom? We cannot measure the depth of the pain, only the patient will tell. Even though there are scales like VASL, visual analog scale of pain assessment, and that assessment is purely based by the information given by the patient. Okay, so pain is a symptom. Numbness, again, it is a symptom. Paresthesia is a symptom. Okay, and giddiness, the patient is telling that I am feeling giddiness. That is again is a symptom. Nausea, tendency to omit is a sign. So since I told about the nausea, omitting is a sign, whereas nausea is a symptom. Omitting is a sign and nausea is a symptom. And so symptoms are the things what it's a subjective matter that can be told by that can be said by the patient. The patient, from the patient information, we can finalize the symptoms. Okay, and what's the problem with the symptom? This is not truly reliable, and it lacks reliability and validity. Symptoms lacks reliability and validity, whereas signs are reliable and valid. Okay, here comes the reliability and validity. What do you mean by reliability of a condition? Reliability is nothing but the consistency. It's the consistency of a particular test is called as the reliability. Reliability R is equal to C. Imagine this equation. Think about this equation always. Keep in your mind, R is equal to C. That is, reliability is equal to consistency. And what is validity? Validity V is equal to accuracy. Validity V is equal to accuracy. I'll give a small example. in order to understand the reliability and validity. For example, if you are testing 10 group of people, 10 people in a group. Imagine there are 10 people in a group and you are testing them for their high blood pressure. Of these 10 people, 8 people shows increased blood pressure. After repeated testing, 8 people shows that they are having increased blood pressure. So, your reliability percentage is 80. Out of 10, after repeated test, 8 people shows high blood pressure. That means you have a reliability of 80%. And how will you test the validity of this group? Of these 10 people, 8 people are having high blood pressure. Okay, and of these 8 people, 6 out of these 8 are having a blood pressure of 145/95. Of these 8 people, 6 people are having a blood pressure of a systolic blood pressure of 145 and a diastolic blood pressure of 95. And the rest 2 are having various blood pressure. That is, one is having 138/42 and the other is having 137/43. Sorry, 137/92 and 137/93. Okay. And here in this case, of these 8 people who are having the high blood pressure, 6 are having 145/95. That means 6 people shows a constant number after repeated test. That means 6 people shows a valid result. So your validity ratio is 60%. After repeating test, these 6 people shows that exactly same number, 145/95. Whereas 2 of these one shows 138/92, 137/93. Okay, but these falls within high blood pressure, so they are actually reliable, but those 2 are not valid. So you got the difference between reliability and validity. Reliability shows the consistency and validity shows the accuracy. Okay, so whenever you are doing a testing for a particular condition, always look for the reliability as well as the validity of the test. And the next important one is the sensitivity and specificity of the test. Little bit confusing. So first let us see what is sensitivity. A test is considered as sensitive when the test ability to designate the individual with disease as positive. You got it? A high sensitive test is the one which the individual designated with the disease is considered as positive. So imagine a person is suspected of some particular disease and he is going for test, and after the testing, when the result come, if he is tested positive, that particular person, that particular test is having high sensitivity. That means positive is equal to positive. That means true positive. A person who is suspected of a particular disease, after testing, again he comes as positive. That means true positive. That means that test is sensitive. This is my equation. This is my equation. Plus is equal to plus in bracket, that is true positive. A person who is designated with a disease, after the test, if he finds that he is tested positive, that is called the true positive. That means that test is sensitive. That is positive is equal to positive. That means after the test, it is called as true positive. That means that test is how high sensitivity rate. But usually what is a human psychology? When you test 100 people who is suspected of a particular disease, if all the 100 people are tested positive, people will think, oh, there is something problem with that testing procedure, or something problem with that problem with the lab where the test is done. Then what will do? The testing will do an adjustment in order to get a high sensitivity rate. What the testing will do? They will give few false negative. They will give some false negative. They'll give some false negative. They'll give some false negative. Okay, when out of 100 cases tested, I'll give an example. If a particular area of the people are tested for COVID-19, example 50 people are tested for COVID, or 100 people are tested for COVID-19, okay, and out of that 90 people are tested positive and 10 came as false negative, the sensitivity rate is 90%. Okay, if everyone is tested positive, if every individual is tested positive, all the 100 people are tested positive, the sensitivity rate will come 100%. But people will think that, oh, something wrong with the testing procedure. Why all the people? So in that case, if some or few negative, false negative will make a high sensitivity rate. Got it? Few false negative will increase the sensitivity rate. Okay, and sensitivity is nothing but the positivity. So again, sensitivity, a test is considered sensitive when a individual designated with a disease is tested positive. That means positive is equal to positive. So when the person designated with a disease or suspected with a disease, after testing, when she considered as positive, it is called as a true positive. That means that particular test has got high sensitivity. In order to enhance the authenticity of this sensitivity, if we get few false negative, the authenticity of the sensitivity can increase, which will again increase the sensitivity rate. Okay, and next comes the specificity. What is specificity? Specificity is of the test means an individual designated with the disease, after testing, if his result comes as negative, that means the test is having high specificity. So a person who is suspected with a disease is coming as a negative. Imagine a person who thinks that I don't have any disease, but still I have to go for testing. And after testing, if the result comes as negative, that means it is considered as a true negative. That means that test has got high specificity. Again, what is the problem? If you are testing for COVID-19, 100 people are testing for COVID-19. If all the 100 people are tested negative, what will happen? What will happen? People will think that something problem with that testing, something problem with that testing procedure, or something problem with the lab where it is tested. So automatically what they will do is that they will keep some false positive. They will keep some false positive. So, if 100 people were tested, if 90 tested negative, they will keep 10 as false positive, which will increase the authenticity of this test. The specificity rate will increase if they produce few false positive. So, negative is equal to negative. A person who is considered as a negative for a particular disease, after testing, again if he is considered as negative, this is called as true negative. It's called as the true negative, and that means that particular test has got high specificity rate. In order to increase the authenticity of the test, what the testing can do is that keep few false positive, which can increase the authenticity of the test. So that is called the sensitivity and specificity of the test. Okay, and plus is equal to positive is equal to positive in bracket, that is true positive. That's a person who is considered as a positive when he is going for a test. When the result come again, if he is positive, that is called as true positive. That means the test is having high sensitivity. A person who considered himself as a negative, and after the test, if the result is again negative, which is called the true negative, that means the test has got high specificity rate. In order to increase the authenticity of the test, for sensitivity we can keep few false negative, and for specificity we can keep some false positive. And this equation, positive is equal to positive in bracket true positive, provided some false negativity can be added to the sensitivity test, and specificity negative is equal to negative in bracket true negative, provided in order to increase the authenticity of the specificity test, some false positive need to be added. And this formula is formulated by me, and anybody is making a copy of this formula without my permission will be prosecutor. Just kidding. Okay, this is DK formula. Positive is equal to positive, bracket true positive, and negative is equal to negative in bracket true negative. This is the simplest way. This formula I formulated when I was doing my masters. So I studied by research methodology and biostatics by myself. So I need to formulate a formula which I think, when I talk to some of my friends, this is the best formula to remember. And you won't see it in any book or any review of literature or anywhere you can see. This is the formula which is created by me. Okay, so this is the best way to learn the sensitivity and specificity. And sensitivity always deals with the positivity, and specificity always deals with the negativity. Okay, so when you say that, that particular area, that particular area has got high rate of sensitivity for a particular disease, means what? That particular area is affected with that particular disease. And if somebody is saying that, oh, that particular area has got high rate of specificity, means that particular area is free of disease. That shows the negativity as well as the positivity. So with this, I am going to stop this video, and I don't want to drag, because some of my students they told me that some of my videos are a little bit longer, especially the static and the dynamic stability. I tried to shorten the video, but if I want to explain in a proper way, I need to go for longer duration for my videos. And so the dislocation, the anterior dislocation especially, I'm going to explain in my next video. And before going to the anterior dislocation, I tried to explain the basic anatomy, where especially in case of complications arises with the anterior dislocation of the shoulder. And hopefully we can finish the anterior dislocation by 2 videos. Okay, hope you understand regarding the signs and symptoms and these other criteria like the reliability, validity, sensitivity and specificity. And again, I'm telling that keep this formula in your mind. This is the formula created by me, and you cannot find it anywhere, and this is the best formula you can understand in a better way about the sensitivity and the specificity. Thank you so much. Bye bye.